is Dr. Shumard from Integrated Wellness Center of San Diego. And today I've got an amazing topic that I want to talk to you about. Probably one of the most common things that I get asked in my office is how can I reduce my blood sugars? So we're going to be talking about how you can reduce your blood sugars, the common things, and the things that I talk to my patients about with the best outcome to reduce your blood sugar. So make sure if you're watching this video either live right now or if you're watching it at a time where it's being replayed, make sure you take some notes because this is going to be some great information. But before we go over that information, I want to just talk to you a little bit more about a patient that I just had. I just came out of a consult about 30 minutes ago, and another one of our patients has reduced their medication. He was taking 500 milligrams of metformin every single day. He's now off that completely and normalizing his blood sugars, having more energy, feeling amazing, and just reestablishing that quality of life that he really wanted to achieve. These are the types of things that we see happen in our practice every single day. So if you're looking for that type of outcome, if you're sick and tired of dealing with your diabetes and taking more medication, and the only option that you're given is more medications or changing some crazy, ridiculous diet, maybe you need to look into our office or another doctor that is doing the work that we're doing to get those types of outcomes. So pretty amazing stuff. We see this happening regularly in our office. We rarely ever see a patient fail, which is a lot of fun and excited to go through that path with them. But today's topic is really going to be important because oftentimes when I'm having consultations with patients, the most common thing that they want to know is how can I reduce my blood sugar? What are some of the things I can do to reduce my blood sugar? And maybe they're already doing multiple things that they've either read on Google, I call it Dr. Google, or maybe heard from another practitioner or someone to help them reduce their blood sugars. So these are some of the things that I want to talk about because this is very, very important that we understand these things. So let's talk about some of the things that you can do to lower blood sugar. So let's go through some of the notes. The first thing we can do is obviously you can exercise, right? We know that exercising can help lower blood sugars, right? You've probably done it before. You've ate some food and next thing you test your blood sugars, you go exercise, you come back, your blood sugars are better. We know that exercise can reduce blood sugars. So we also know that weight loss can also help reduce blood sugars, right? So if you're burning the calories and for exercise, you're losing weight, you're obviously going to start to see your blood sugars come down as well. We can also see dietary changes. And I know some of you are actually saying, well, I already do these things and everything, but there's a point. Please stay with me through this video because there's a point while I'm going over these things. So diet changes, obviously, you start to cut the carbohydrates, you don't eat the baked goods, the pastas, the pies, the grains, those sort of things can also help you reduce your blood sugars by reducing the impact on those foods that the body has to go through. Now, there's some other things that are maybe non-traditional that some of you may be doing or have been recommended. We know that things like cinnamon, right? Some of you may be adding some cinnamon to your diet, or you're taking some cinnamon supplements or cinnamon tea, whatever that is. We've seen that help with blood sugars. We've also seen things like magnesium. Magnesium can also help with blood sugars. That's been shown to regulate and stabilize blood sugars. Things a little bit more advanced, maybe berberine. We've seen some people taking berberine to help lower blood sugars as well. And there's probably some other ones out there. Oh, another common one, would be chromium. Chromium is another one that we've seen people take that are actually help blood sugars as well. Now, some of you may be taking some of these things right now. You're maybe doing the exercise, you're doing the weight loss, you're doing some dietary changes, maybe you've added a couple of these things in, and maybe you're seeing some good changes, but maybe some of you are not as well. Now, the point of today's video is that these items, and there's probably some other ones as well that are on this list, we could probably list another 10 more, but it wouldn't be to the point of what I'm trying to get to today. The point is that all of these things, what they've been shown to do is to help lower blood sugar. So only help lower blood sugar. Now, why is this so important? Because when we're dealing with diabetes, elevated blood sugar is a symptom of diabetes. It is not the cause of your diabetic condition. This is so important you get this, because many people, they're so focused on trying to lower blood sugars because they're being told by their traditional healthcare provider or some other provider, you need to lower your blood sugar, lower your blood sugar. And don't get me wrong, lowering blood sugar is very important. Elevated blood sugars can cause major damage to the body, cardiovascular problems, brain dysfunction, joints, organ damage. We can cause neuropathies. I mean, many problems can happen if you don't have good blood sugar. But if your focus is only to lower the blood sugar, then you're only trying to reduce the symptom. See, right now, all the treatment you're doing, I guess that's one thing we forgot to put on here, is traditional pharmaceutical meds, right? Your metformin, your glipizide, your glyburide, your insulin. All these things are all to try to reduce blood sugar and reduce blood sugar only. Nothing is focusing on what is causing the symptoms. What is causing your blood sugar to go high? And many of you are thinking right now, oh, it's because of my diet, it's because I'm overweight, and those sort of things. Of course, those could be contributing factors, but I can tell you they're not the only reason why you have elevated blood sugars. I talk to so many patients on a weekly basis that they're not overweight, they have a great diet, and they're exercising, and their blood sugars are still elevated. So if these were the actual cause of your blood sugars, then how are there going to be individuals who are skinny? How are there going to be individuals who exercise on a daily basis, who eat a good quality diet, that still have elevated blood sugars? So again, your elevated blood sugars is a symptom of the disease. So your elevated blood sugars don't tell you have diabetes. You have diabetes that is causing you to have elevated blood sugars. And if your focus is only to reduce the blood sugars, you're going to miss the big picture here. What we need to really focus on is what is the cause, right? The cause is the most important. So the cause is what we really need to focus on. If you're just focusing on these guys only, yes, you may make some improvements. Yes, you may still see less weight, maybe better quality diets, maybe your blood sugars will come down, but over time, because you haven't focused on the cause, the disease is going to get worse. And as the disease worsens, not only will your blood sugars increase, and the only option you'll have is to take more medications, but other areas of your body will start to break down. And you'll start to have other symptoms. Maybe you start getting digestive symptoms. Maybe for males, you start getting prostate symptoms. Maybe you start getting kidney problems, or you start getting brain fog or memory loss. Cardiovascular, blood pressure starts to go up. Your heart rate starts to go up. You start getting neuropathy, you can't walk, you have pain, your legs start to swell. All these symptoms are developing because the disease is getting worse, and because our only focus is trying to reduce blood sugars. So what the point of this video is really all about is you need to make a decision. That decision is, do you want to focus continually on the symptom only, or do you want to find the cause? Because once you find the cause of your diabetic condition, then you can start working on that specifically. Now, here's what I can tell you. The cause for your diabetes is going to be unique to you. There is no one-size-fits-all approach. There is no one-size diet. There is no one-size weight loss and those types of things. There's maybe not even any exercise that may not be beneficial for you. So we have to focus and customize a protocol, a program, if you will, to your needs. If you're sitting here right now listening to this and you have diabetes, or maybe your significant other has diabetes, a family member, a coworker, someone you care about has diabetes, make sure they watch this video. It is so important. It very well may save their life. Because when we focus on the cause and not the symptoms, we actually help someone reverse their diabetes. Reversing means this: we lower and reduce and even eliminate, in most cases, medications. Not just their blood sugar medication, but across the board. Because remember, a lot of the other symptoms that they're experiencing is due to the underlying mechanisms or their diabetic condition. We also see patients reducing weight with little to no exercise. That is so important. Many of our patients that we see, I don't even let them exercise because they're not ready for it. And of course, we also see our patients reducing the risks of future complications, right? What that means is neuropathy, amputations, cardiovascular problems, kidney issues, brain dysfunction, peripheral arterial disease. I mean, we're talking about from head to toe, as a diabetic, you can be impacted in creating symptoms and problems. So some of you who are listening to this right now, maybe you're in the early stages of your disease process and you're just not really concerned because you're not having all these symptoms. Well, here's the thing. If you talk to somebody who's already had all these symptoms now, they were once in your place and they wish they would be back there. So you could either continue on thinking that if I just focus on trying to reduce the symptoms, the low blood sugar, it's going to fix the problem, or you can find someone who can help you create a solution to the cause of what's really going on. So I hope that this video actually helps you understand a little more about diabetes and to focusing on the traditional avenue, which is the symptoms, rather than the cause, which is what we do in our office through functional medicine. So if this video was valuable for you, please comment, let me know that you enjoyed it, like it, and of course we would love if you shared it. This information is so important that we get it out to so many people, because the more people that we can help, the better quality of life, the better society that we have, and reducing the risk of these future complications, reducing the risk of an early death, right? As a diabetic, we have a chance of an early death. So our family deserves us to have a good quality life, our grandchildren, our children, our people that we have in our life, and just, hey, there's probably things that you still want to do in this life. So if you have the motivation, if you are ready to get better, you can always reach out to us so we can help you and get you the results you're looking for. I will post our contact information in the comments. So if this video is relevant for you or maybe someone in your family, you can always give our office a call and schedule a consultation with me, either virtually or one-on-one in person. I'd love to try to help you any way that I can. All right, thank you guys so much. Have a great rest of your day, and we'll chat next time. Take care. Bye-bye.